instructed me, I will be speaking more about basics of PRP, including how we have progressed from autologous to lyophilization. So it's more of a scientific evidence which we are building to utilize PRP more. So once again, I am so much thankful to Dr. Ravi, Natesh and the whole Trichy citizens for calling us over here, inviting Indian Stem Cell Association, and we are a group and we enjoy working and propagating regenerative medicine across India. So it's like first time we are here with you, and thank you so much, Ravi sir. My talk is on platelet-rich plasma, autologous, allogenic and lyophilization. I bring greetings from my institution, which is Datta Meghe Institute of Medical Sciences, located that in central of India. So if you are like fond of playing dart game and if you hit 10 by 10, you will hit me with the Indian map. So platelet-rich plasma, the talk is will be covering few things like definition, properties, preparation methods, how we can yield a good quality from autologous PRP, because that is mostly done in the small labs, allogenic PRPs, lyophilization, and of course we'll conclude. So what is PRP? We all know this. It's just a concentration of platelets, right, in a small volume of plasma. That is, both are important. Now, what is good enough? How much concentration is good enough to work for platelets? There is no certainty about it. So by definition, when we come to the definition of it, they say 3 to 8 times. And there are a lot of evidences which say everything works. Now, fortunately, we have been able to identify that if you are using the PRP for soft tissue, it is up to 5 times. And if for hard tissues, it may be about 8 times. The good concentrate is like therapeutic concentration of 1 million per ml. That is 10 legs. That's a good therapeutic concentration, and that should be the target to achieve when you are doing this, using PRP as a therapy. We all know this. It's very exciting to work with regenerative medicine. You know, 19th century belonged to physics, 20th belonged to chemistry, and this is our era. 21st is us. Why? Because of 2 things. One, development of genetic decodings, and second, regenerations. Till now we were not talking of regenerations. Now we are talking very excitingly about regenerations. Both previous speakers, they showed you how regeneration can help to regain those things which were thought to be of like natural sequelae disease. Nothing can be done, let it grow, we'll interpret whenever it is possible. But then things are changing. And the reason are these things. We are able to identify in a human body itself as a power to regenerate. Now the big question is, we do not know exactly how much and when. So I think so throughout the day you will be excited to note down this. Everybody will have a little bit of variability into it. So what my purpose is to bring to your notice that people are trying, but still the answer is not definitive answer is there. Maybe we may not land up in a perfect situation, but at least our imperfection should be able to help the patients. So 4 types of PRPs, we all know this. Yesterday PRP session was being held. So not going into details of those things. Why it works? These are what I say is top 5 mafia of PRP. These are the top 5 growth factors which work for you in any situation. So you'll have a look at them. Epidermal growth factors, necessary for skin growth. Insulin-like growth factors, necessary for healing. Platelet-derived growth factors, PDGFs, TGFs and VEGF. All are very, very, very necessary for angiogenesis. So, how does a stem cell in PRP differs? If a lot of youngsters are there, let them understand this. A stem cell divides and then it leads to healing. PRP triggers the environment through these growth factors and leads the cells which are there present to immunomodulate, develop a molecular response and then grow. So that is the basic difference. So like both are different things, and PRP is the easiest regenerative medicine product which is available as of today. Hardly any cost, You can make it in your own labs, in a small clinic. So for all of us, as a beginner, this is the beginning point. This is the starting point from you can start your race. What does this mean in clinical settings for all of us as a clinical clinicians? It just means it will stimulate healing and induce tissue regeneration. So is it like platelets which work? No, these growth factors are inside a alpha granules. And once you inject, they get destroyed and they liberate growth factors. Now this is a very interesting concept because somebody talked about, sir talked about activation of the PRP. So what are you trying to do by activation? You are wanting to heal this. So either you do in vitro or you do in vivo. Definitely if you do in vitro, you are sure it is happening. But if you allow it to go as a paracrine process in vitro, in vivo, you do not have enough evidence that is it happening at the right time. So that is what is still, it's a bit of unknown territory. But yes, there are enough evidences where we say autocrine process works good enough for, so there is no need for activation. In my, almost like I am practicing with PRP since 2009, so it's almost 15 years. And I have been using autologous non-activated PRP most of the times. So what does it do? As I said, it will proliferate the cells, increase expression of anabolic genes and proteins, and most importantly, it's pro-inflammatory, it reduces the inflammation. That's very important. So, sir said it will cut down the fibrosis. How? By this. So, it will cut down the fibrosis and replace it with the collagen tissue. So, it's a pro-inflammatory reaction. And till today, rather I will say till yesterday, we didn't know how to heal tissues with collagen tissue. Because every time we did surgery, we produced a scar. We had a fibrosis as an ending. Now things are changing. With the help of all these regenerative, particularly PRP, you can have collagen end instead of fibrotic end. And collagen is elastic tissue. Definitely, when it stretches, it is not painful. Any scar which stretches, even it is a ligament, muscle, tear, anything, it is painful. So this pro-inflammatory reaction leading to collagen as an end stage is very, very important understanding which have come up by the use of PRP. And not only this, it has got an antibacterial effect also. Now watch me over here. This is such an important thing that this is going to be tomorrow's answer for your MRSA and antibiotic resistance. It works against almost the two commonest bacteria of which we harbor, Staph aureus and Streptococcus. It has got a very poor response for pneumococci and E. coli. But as of today, in my practice, in infected wounds, I do not give antibiotics. However bad it is, it may be MRSA, but just keep a watch on it. And most of the times PRP have never ever failed me on this aspect. So antibacterial effect is very significant effect which is being recognized and being utilized from PRP. And they are all synergistic in combination. So somebody was asking, what things we can combine with stem cells? Can you combine PRP and stem cells? Yes, you can, because both are different things. They are going to act in a different manner. Preparation techniques, just a very basic, see, what is blood? Blood is liquid, plasma, where you have suspended particles. So if you are right with your basics of physics, you know, if I churn something with a specific gravities, they will separate out. So it's just a centrifuge process, very basic process which will separate WBC, platelets and RBC. The heaviest will sediment at the lowest most part and the lighter will float. And that is all you need to do to have a good PRP preparation. If you understand this, then you should know what variables are there in your practice to make a good PRP. Variables can be volume, variables can be thickness and lot many things. And these variables may be differing from person to person as well. So the standard technique for preparing PRP, which is FDA approved, is double centrifuge technique. Single centrifuge high RPM technique is being popularized, but still it is not approved for clinical use. For the simple reason because if you centrifuge with a high RPM, it will generate heat and it will lead to destruction. So high RPM are avoided. First centrifuge is with a soft spin, because you want RBCs are very heavy particles. With a soft spin they can settle down, and you want to remove first from the RBCs, and then you want to remove WBCs and platelets. So you can go for a harder spin. So there are different rates by which you can, what is exactly like the correct rate nobody knows. Every machine will behave differently. And when I say every machine, I do mean even the standardized machines. So you need to observe and send a little bit of sample to know if you are able to prepare the right kind of PRP every time. So if not every time, at least few times, once in a week, or whenever new patient is coming, because you may be needed to adjust the rate of centrifuging, RPMs as well as time, both for particular person also. So my advice is like, when we are talking of precision medicines, let us customize these preparations also. So see this, all have got with the different rates the same result, almost 3 to 8 times of PRP. Single spin, high spin also, and double slow spins also. So what it takes to make good quality autologous PRP? PRP can be made from small volume bloods, right from 10 ml, 20 ml, 50 ml as well. So you need not draw a huge blood. You can do as much you need to PRP, and usually all of us have the same experience. 1 to 2 ml of PRP is good enough to trigger regenerations. Everywhere. That's, I mean, like, it's very surprising finding. So I have a wound which is this big. For that also 1 to 2 ml works, and wound which is this small, for that also 2 ml works. And as sir also said, for him 1.5 ml works effectively, and Vishnu also said for him also 1.5 ml works effectively in the bone. So basically it's not the volume, it's the number of cells which are counting. And here it is the growth factors availability which is like working. So usually we avoid take with a large bone needle, centrifuge at a faster technique. There is a formula over there by which you can calculate this right centrifuge times and RPM for your fluid to spin, that is blood to spin, to get a good yield. Temperature. Now again, room temperature is mostly good enough, unless until you are using a high spin, single spin, high RPM single spin problem. Then you need a cooling cabinets. Otherwise this is good enough. Anticoagulants you may use, but citrated blood is the one which is advised. Activation already debatable, and autocrine can also work. So what are the different sources? We have talked about autologous source, how to prepare it. The other source is allogenic. So what exactly? See, there is a slight difference between allogenic and homologous. In the scientific community, we say that allogenic and homologous are at par. But when we talk of stem cells, when we say allogenic, we mean stem cell from pancreas going to pancreas, bone going to bone, and homologous means MSCs from one person going anywhere in the other one. Target tissue may be anything. So when we say allogenic, we want in this PRP which are ABO and RH matched. That is what literature says. So you cannot have, though grouping will not matter for platelets, we know this. But when you use term allogenic, it has to be like that, right? Preparation is same for allogenic and autologous both. Safety is the challenge, because allogenic there is a risk of transmission of disease from one point to another point. So we need to have a very good screened blood to be used. Advantage, you can have in adequate quantity, there is no dearth. You can take a bag, purchase a bag from blood bank and make a PRP and make 50 ml of PRP as well from 500 ml. There is no dearth of it. The good indications for using allogenic would be the patients on whom autologous cannot be done. So those who have platelet deficiencies, anemias, malnutrition, bleeding disorders, including from where you cannot draw blood because of some local site problems. And I have been using allogenic particularly from mother and father for child, because I am unable to draw repeated blood from child. Though it is not currently widely used, and you can see behind me there is a propagation of allogenic cells, so it is coming up commercially as well. Clinical effects. This is a clinical effect from our own lab of autologous PRP in a diabetic wound. and this is the effect from literature of allogenic PRP. Hardly any difference. So almost same results. So it is not the source which is working, it is again the growth factors which are working, availability of growth factors. Now can I segregate these growth factors away? So we went ahead a little bit more and started lyophilizing processes in our labs. You all know lyophilization is converting liquid into a powder form. So this is, it has got two steps. You can do process, first is like processing for PRP. So you take a bag from, which we call as a mother bag cell from blood bank, and then which is mostly for, okay. So centrifugate to prepare PRP, and then you will do lyophilization. It's simple. Lyophilization is like, so we have one more machine during processes, that is platelet expressor cell machine, and then lyophilize it. So we lyophilize it, and then the big question was, how do we store it? At room temperature, 8 degree, minus 80 degree, will it work? Is it equal to the growth factor yield? Is it equal to the autologous one? Or is it better? So we did whole studies and did everything in the labs and found what I have written here. The growth factors in lyophilized PRP is more than autologous, freshly prepared or allogenic leukocyte PRP. For the simple reason, you are concentrating them more higher. The LPRP can be stored, the L is for not leukocytic or lyophilized, can be stored for around 90 days without the concentration going down. Fresh PRP cannot be. Temperature, best temperature, 8 and minus 80 degree both works, but you know at minus 80 degree it is difficult, you need a different setup. 8 is so simple, you just keep in your fridge, non-commercial fridge shelf. And then agitation time and thawing time is also less. So if you want to utilize lyophilized PRP, it's so simple. Take a blood bag from blood bank, express the platelets out of it, lyophilize it in a lyophilizer and store it at 8 degrees and then reconstitute it with the help of 1 ml of with the sterile water only. You don't need anything else, and it works as well. So lyophilized PRP maintains a high level of growth factors, particularly at 8 degree, it can be reconstituted easily and affordable, accessible. So this is one of the, and we have tried it on the preclinical situations in rabbit model, and it worked very well. So you can see over here, the lyophilized PRP has equal effect as fresh PRP. Without any pain of making PRP every time, you can use it as an off shelf. So to end, I would say PRP, it may be autologous, allogenic lyophilization is feasible, effective and safe biological therapy. Out of all those things, at least last thing is proven by now. There is no risk in using PRP. Effectivity and feasibility is like getting built up, but definitely it is there. And autologous allogenic lyophilization, what lyophilization has done is off-shelf availability of it, and these are different conditions which you can use. For all of those who are interested in reading more about PRP, there is a book written by us. You can read it, or you can contact me decoding those things. Thank you so much for calling us.